As we mentioned, cases are declining, but deaths are not. They are rising. That's according to the CDC Director, Dr. Rochelle Walensky. And access to the vaccine continues to plague communities of color. Joining us to discuss just this is Dr. Jennifer Caudle. Thank you for joining us.
Thanks for having me.
Now, a new study suggests that mistrust is no longer an issue, but vaccine access is now a major concern. Black people only make up just over 5% of those being vaccinated. How do we expand access to communities that have been impacted the most?
That's an excellent question. I would actually argue, though, that mistrust and vaccine access are issues. There are still a number of people, many people, for good reason, have trust issues. We've certainly talked about those before, whether it's from the systemic racism that we've been dealing with for so many years in this country or other reasons. Mistrust is still something we deal with. However, you're exactly right. Vaccine distribution has been a problem. We do know that more white people have gotten the vaccine than, say, Black people or people of color. That is a problem. Now, that's likely multifactorial, which means it's likely due to a number of reasons. But this is something that I say we collectively, as a healthcare provider, as a Black healthcare provider, I and many of my colleagues have been worried about. We know that Blacks are disproportionately affected by COVID. We are more likely to be hospitalized for COVID and more likely to die from COVID. We are higher risk by virtue of race and demographics. It is crucial that African Americans get this vaccine, and it is terribly troubling to see that as the vaccine's being rolled out, we are getting the vaccine in smaller proportions than other people. What to do about it? There's a lot that and not to keep going on and on, but there's a lot that has to be done about it. We need education for everyone. We need vaccines to come to the people. Not just, oftentimes vaccines and certain types of services may not be within reach physically, literally. So we need vaccine sites in neighborhoods, in churches. We need vaccine availability everywhere, amongst so many other things.
And as a Black healthcare provider, you've been very vocal about your journey with your vaccination. Can you tell us about some of the comments that you were receiving?
Yes, I certainly can. And you're right. I received both doses of the Moderna vaccine. I'm a practicing family physician. The COVID vaccine is something I'm recommending to my patients, to my family, et cetera. I did get both doses of Moderna. And one of the things I do, I'm also a video creator. So social media, I do create videos for Facebook, Instagram, YouTube, et cetera. And I've journeyed and journaled rather my process getting the vaccine. I have to be honest with you. And I was transparent. I did have some symptoms after my second Moderna vaccine that went away after about 48 hours or so. I took some over-the-counter medications, did just fine. But the comments that I get, really range from pure skepticism to downright vile comments, ranging from some people really do not believe that the vaccine is good. Say Some people say that I hope you don't turn into a zombie. I hope things, you don't become infertile. Lots of myths about COVID-19. Other people say that, the COVID vaccine is problematic. There's so many different comments that I hear from people, and it really just lets me know how many myths are running around out there. But what it does, though, I have to say, is it encourages me to keep talking about this. We have to keep talking about the importance of the COVID vaccine. I'm hoping that my experiences will inspire, encourage, and reassure other people to go through this process.
I mean, those comments are quite disturbing. I hope you don't turn into a zombie. I hope you don't become fertile. I mean, how do we go from that
Infertile.
to we need you to be
Right.
vaccinated so we can return to some type of normalcy?
Right. Well, that's an excellent question, and I have to say, some people do ask me. I think sometimes my followers who don't feel that way, they feel bad when others comment, and I see them sometimes sticking up for me on social media. But I would rather hear what people are worried about and what they're saying and what they're thinking, because the problem right now is that there's a lot of misinformation on social media. You can get your news from all sorts of sources, for better or for worse. And what this does is it lets me know just how important it is for healthcare providers, for politicians, for news networks to be speaking the truth. In addition to fighting the COVID pandemic, we're really fighting a pandemic of misinformation and disinformation as well. People have so many incorrect and false beliefs about this vaccine. And the problem with that is that It will literally kill us to have those ideas. Getting this COVID vaccine is one of the best things we can do to get us out of this pandemic to save lives. So it literally is one of my life's missions, honestly, in the last 12 months, amongst being a physician and treating patients. It really has been, my life's work lately to try to dispel myths and really get out proper information to people, hoping that I might be able to change people's minds. Even one person at a time, I will take.
Dr. Caudle, I wish I had like another 3 minutes with you because your insight is so valued, but unfortunately we have to
Thank
wrap.
you.
It was a pleasure having you, and we look forward to having you back. Have a great afternoon. And we'll
Thank
be
you.
back with
You
more
too.
news that matters to you. You're watching BNC News.